Now our closing session is starting. This is all about healthcare. COVID-19 impact is all about healthcare. And our co-host, Martin Dow, especially planned this session about healthcare because this is key for the progress of Pakistan, the infrastructure development for our healthcare institutions. Our first speaker is Mr. Mohammed Aasim Yusuf. He is the Chief Medical Officer and Acting CEO of Shaukat Khanum Cancer Hospital. He will talk about the Shaukat Khanum Karachi project. And after this talk, we will host our speakers, Mr. Harun Qasim, Mr. Douglas Cawley, and Mr. Joy Wilson on the future of healthcare. Mr. Aasim, please.
Assalamu alaikum. Good afternoon. I'd like to thank Asfar and the organizers for giving Shaukat Khanum the opportunity to address you all today. In the next 15 minutes or so, I'm going to give you an overview of our first 25 years in Lahore and more recently in Peshawar. And then, since the main aim of this summit is to discuss the future, so we're going to have a few slides on the future here in Karachi, where we have just started construction of our third cancer hospital. So this is our hospital in Lahore, which opened in December 1994. Many of you will probably have seen this image. 5 years ago now, next month, our second hospital opened, which was in Peshawar. I'm having some trouble with this, sorry. And so, as many of you may know, the main inspiration for making the hospital in Lahore was the fact that Imran Khan's mother, who was called Shaukat Khanum, developed colorectal cancer in the mid-80s, and it was her struggles and the struggles that the family faced in obtaining optimal treatment for their mother, which was part of the inspiration for the hospital in Lahore. But as Imran always says, the main inspiration really was all the suffering poor patients that he saw in the government hospitals and elsewhere in Pakistan who could neither afford the diagnostics and nor certainly the treatment for cancer. And he always says that that was the main inspiration for building a hospital dedicated to the memory of his mother, but designed to treat the poor and the needy. So this is our mission statement. You don't necessarily need to read the whole thing, but the key elements of the mission statement are outlined in red. We aim to act as a model institution to show that it is possible to achieve excellence in Pakistan. I don't need to tell this audience that, but that this is not an alien concept that is unachievable here. We are primarily a cancer hospital, obviously. And the most important line, our raison d'etre, if you like, is in the fourth line, which is that once a patient is accepted into the system at Shaukat Khanum, they're treated irrespective of whether they can pay for their care or not. Because our reasoning is that some people will pay for their care themselves, while everyone else has been paid for by someone else. We also have a role in education of healthcare professionals as well as the public. And finally, we are a research center, and we contribute in quite a significant ways to the medical literature from Pakistan on cancer. So the cancer incidence in Pakistan today is estimated at about 170,000 new cancers per year. Because of the late stage at which the majority of these patients present, between 60 and 120,000 of these patients will die within the year of diagnosis, which is up to 70% of those patients may succumb to their disease within the year of diagnosis. And this was one of the main reasons why we have continued to try and grow initially in Lahore, then secondly in Peshawar to the northwest, and now down south in Karachi. The network of yellow dots that you see across the country are our laboratory collection centers, which are available for anyone to go and have a lab test at, the proceeds from which then are plowed back into the system to help develop our facilities and to treat more cancer patients. So as you've seen the top two pictures here, the bottom picture in this frame is the architect's rendering of the new Shaukat Khanum Cancer Hospital in Karachi. So far, in just coming up to 26 years now, on the 29th of December this year, we will have completed 26 years of clinical function in Lahore and 6 years in Peshawar. Consistently, we have treated more than 75% of our patients completely free, and in this time, because of the support of our donors and philanthropists all across the country and indeed all across the world, we have disbursed 46 billion rupees in charity. In terms of patient care, any parameter that you look at, the numbers have continued to go up really exponentially over the last 10 years or so. We're close to 190,000 patient registrations, 160,000 surgical procedures, over 3 million outpatient visits, 172,000 admissions, over 1 million radiation treatment sessions, and the numbers just go on and on. Because of the Laboratory Collection Center network, we've done 62 million lab tests in this time. Quality is the bedrock on which the hospital is built, and in April 2018, Shaukat Khanum Cancer Hospital Lahore became the 3rd hospital in Pakistan to be accredited by the Joint Commission International. Many of you will know that the JCI inspects and accredits international facilities to the same rigorous standards as are applied to their own hospitals in the US. So we were only the 3rd hospital in Pakistan to be so accredited, just coming up to 3 years ago now. And then a year later, in July 2019, our hospital in Peshawar was also similarly accredited. So of the 4 hospitals now accredited by JCI in Pakistan, 2 belong to the Shaukat Khanum Memorial Trust. We continue to pursue the highest possible industry-specific quality standards. JCI we've mentioned. We participate in the College of American Pathologists quality accreditation programs. We have HACCP certification for our food services. And we are especially proud on the bottom right there of the ASHP accreditation that we achieved earlier this year. This is the American Society of Healthcare Pharmacists, which runs all residency training programs for pharmacy, for clinical pharmacists in the United States. We are one of only 2 institutions outside the United States to have ASHP accreditation, the other being in Egypt. And we have a number of other awards, certifications, and affiliations to our name, including from the WHO. We're certified by the Pakistan Center for Philanthropy. We're a member of the OICCI, or the International Union for Cancer Control. Excuse me. And we've won numerous corporate excellence awards from the Management Association of Pakistan. So coming to the hospital in Karachi now. This is Pakistan's 3rd Shaukat Khanum Cancer Hospital and the biggest. It's double the size of the Lahore Hospital, which is 500,000 square feet of covered area. Inshallah, when this opens, it will be 1 million square feet. It's designed to serve not only Karachi, but all of Sindh and parts of Balochistan as well. We in fact had just started construction in March when that had to be put on hold because of COVID, but we restarted construction in September this year. And what's in the building? So in the basement, we have our nuclear medicine and clinical and radiation oncology departments. One of the mainstays of cancer treatment is, of course, radiation treatment, and the radiation bunkers are in the basement there. On the ground floor, we have our outpatient clinics, our cafeterias, diagnostics, women's imaging. On the first floor, we have our chemotherapy bay, the bone marrow transplant unit, the endoscopy unit, and the blood bank, and the main pathology lab. On the second floor, we have our operating rooms and the intensive care unit. And then on the next 3 floors, the 3rd, 4th, and 5th floors are all inpatient beds. And these are the medical specialties we have. We will not obviously be a general hospital. It will continue to be a cancer hospital. And so the specialties we have are very cancer-centric, and we have the specialties that we need to support cancer services. And these are all the same departments that we have in our other 2 hospitals in Lahore and in Peshawar. So the total hospital capacity will be 470 beds, with 48 examination rooms in the outpatient clinics, 69 beds in the chemotherapy bay. The inpatient units will be close to 290 beds, 16 operating rooms, a 24-bedded intensive care unit, a clinical and radiation oncology department with 10 linear accelerators. These are the radiation treatment machines. Just as a measure, we have 5 of these in Lahore. So really everything in Karachi will be twice the size of what we have in Lahore. And then we have radiology and other diagnostics. So it's a 2.5-year project starting in September. We expect to complete operations towards the end of 2023, towards the middle or late 2023, in fact. The total construction costs spread over 2.5 years is 9 billion rupees, with an additional 4 billion rupees at current prices to install all the equipment that we will need at commissioning. So the total cost comes to 13 billion rupees. There are more details of this in the brochure on your tables. That's just some recent pictures of the work that's going on, just to show that it is very much underway now. The project is located in the DHA city, outside the main city, on the highway going towards Hyderabad. It's on a promontory, so it's easily visible from the highway. And we have 20 acres of land there. We're going to start a virtual tour of the hospital now. Just a short video to show you what it's going to look like from inside. So as we always say, it's public support. It's the support of the Pakistani nation that built this hospital. And it's all your support that continues to run it. And it's only with your support that these hospitals will continue to grow, becoming bigger and better, so that we have more and more tertiary care cancer hospitals to treat all the cancer in Pakistan. And we look forward to your ongoing support.
So my question to you is that what are the details of Karachi project? What is the completion time? And what is the complete amount you are raising for this Karachi project?
Okay.
And
So-
is this bigger than Lahore project?
So yes, it's exactly double the size of the Lahore hospital. The Lahore hospital is currently just under 500,000 square feet of covered area. And the Karachi hospital is just over 1 million square feet, so it's twice the size. Given that Karachi is such an enormous city and that this hospital will cover not only Karachi, but inshallah all of Sindh and parts of southern Balochistan as well. The total cost of the project we estimate at this time to be 13 billion rupees to the point of commissioning. That includes 9 billion rupees for construction over a 2.5-year period and 4 billion rupees for the equipment, which will go into it at the time of commissioning. The timeline to the best estimate at the moment is the autumn of 2023. So around September, October 2023 is when we think this will, inshallah, open to patients. So some other supporters across the generations. And in closing, I'd like to thank you all again for your attention and the organizers again for giving Shaukat Khanum the opportunity to speak here. We look forward to your support. Karachi is the city that taught everyone else in this country about philanthropy and charity, has a long tradition of charity, and we look forward to your support in the years to come. You've always supported the hospital even when it was in Lahore and in Peshawar, so this is now a hospital in your own city, and we look forward to your continuing support. Thank you very much.
Thank you, Dr. Aasim. And this is actually our collective responsibility to support these type of projects. Shaukat Khanum is an excellent project. We all are witnessing since last almost 25 years how they are operating in Lahore and later in Peshawar, how they manage. And this is a big project covering the Sindh and Balochistan area, completing Karachi also. So this is my request to all our virtual participants also, which are actually in few hundred thousands. So please support this project, and this is our collective responsibility. So.